Hello, and welcome. Today we're diving into the complexities of Fabry disease, a rare genetic disorder that can significantly impact the heart. We'll explore its origins, how it affects the body, and what can be done to manage and treat this condition. Join us as we unravel the mysteries of Fabry disease and its cardiac implications. Fabry disease is rooted in genetics. It's caused by a mutation in the GL gene, located on the X chromosome. This gene provides instructions for making an enzyme alpha-galactosidase A, often shortened to alpha-GLA. Alpha-GLA is crucial for breaking down a fatty substance called globotriaosylceramide, or GL3, inside the cells of the body. When the GL gene is mutated, it leads to a deficiency or complete absence of this essential enzyme. Now let's delve into the pathophysiology, how this enzyme deficiency actually causes the problems associated with Fabry disease. Because alpha-GAL isn't working properly, GL3 starts to accumulate in cells throughout the body. This buildup is particularly damaging to the cells lining blood vessels, as well as cells in the kidneys, heart, and nervous system. In the heart, this GL3 accumulation leads to thickening of the heart muscle, a condition called cardiomyopathy. It can also affect the heart's electrical system, causing arrhythmias and damage heart valves. Over time, this can lead to heart failure and other serious cardiovascular complications. Fabry disease is considered a rare disorder, affecting an estimated 1 in 40,000 to 60,000 males. Because it's X-linked, males are generally more severely affected than females. However, females who inherit the mutated gene can still experience significant symptoms due to a process called X chromosome inactivation, where one X chromosome is randomly silenced in each cell. This means that some of their cells will have a functioning GLA gene, while others will not, leading to a variable range of symptoms. The signs and symptoms of Fabry disease are quite varied and can appear at different ages. Early symptoms often begin in childhood or adolescence and can include burning pain in the hands and feet, known as acroparesthesia. Other common signs are clusters of small, dark red spots on the skin called angiokeratomas, decreased sweating, and gastrointestinal issues like abdominal pain and diarrhea. As the disease progresses, individuals may experience kidney problems, corneal clouding, and, of course, heart problems. These heart problems can manifest as chest pain, shortness of breath, palpitations, and even sudden cardiac arrest. Diagnosing Fabry disease can be challenging due to its varied presentation. The initial step often involves enzyme assays, measuring the activity of alpha-GALA in blood samples. A significantly reduced or absent level of the enzyme strongly suggests the presence of Fabry disease, particularly in males. In females, however, enzyme assays may be less reliable due to X chromosome inactivation. Genetic testing to identify mutations in the GL gene is often used to confirm the diagnosis, especially in females. Furthermore, diagnostic testing may include kidney biopsy and cardiac testing, such as electrocardiograms, echocardiograms, and cardiac MRs to assess the extent of organ involvement. While Fabry disease doesn't have distinct official types, it can be classified based on the severity of enzyme deficiency and the presence of specific mutations in the GLA gene. Some mutations result in a near-complete absence of alpha-GLA activity, leading to a more severe, classic form of the disease. Other mutations allow for some residual enzyme activity, resulting in a milder or later onset phenotype. Individuals with the later onset form might primarily experience cardiac involvement without many of the other classic Fabry symptoms. Currently, there is no cure for Fabry disease, but there are treatments aimed at managing symptoms and preventing organ damage. Enzyme replacement therapy, or ERT, involves intravenous infusions of a recombinant alpha-GLA enzyme to replace the deficient one. ERT can help reduce the accumulation of GL3 in cells and alleviate some of the symptoms. Another approach is chaperone therapy, which uses a small molecule to stabilize the patient's own mutated alpha-GLA enzyme, improving its function. Symptomatic treatments are also important to address specific issues like pain management, kidney support, and cardiac medications to manage heart conditions. Regular monitoring of kidney and heart function is crucial for early detection and management of complications. Because Fabry disease is a genetic condition, there's currently no way to prevent inheriting the mutated GLA gene. However, genetic counseling is highly recommended for individuals with a family history of the disease. Genetic testing can help identify carriers of the mutated gene, allowing families to make informed decisions about family planning. Early diagnosis and treatment are crucial for slowing down the progression of the disease and preventing irreversible organ damage. The prognosis for individuals with Fabry disease varies depending on the severity of the disease, the age of diagnosis, and the effectiveness of treatment. Without treatment, the disease can lead to significant morbidity and reduced life expectancy due to kidney failure, heart disease, and stroke. However, with early diagnosis and initiation of enzyme replacement therapy, many individuals can experience improved quality of life and a longer lifespan. Excitingly, recent research is focusing on gene therapy, which aims to correct the underlying genetic defect. While still in early stages of development, gene therapy holds the potential for a long-term cure for Fabry disease. Other research areas include the development of more effective chaperone therapies and improved diagnostic methods for early detection. The future for Fabry disease treatment is looking brighter with these promising advancements.